another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Nancy Neiditz. Nancy graduated from NYU's physical therapy program in 1989 and immediately began an in-depth training of the Feldenkrais Method. Several years later, she became an Anat Baniel Method for Children Practitioner as well. A modern dancer and yoga enthusiast, she appreciated the creative approach to engaging and moving children. She started her career as an adult physical therapist at Lenox Hill Hospital in New York City. There she trained with some of the best neurologists and orthopedic surgeons in the country. In 1995, close to the time of the establishment of the early intervention program, she began traveling throughout New York to see children ages 0 to 3 in their natural environments, the home. She mentored with the only other Anat Baniel Method Trainer, Marcy Lindheimer, bringing some of her more severe cases to Miss Lindheimer. She began her journey in learning how to approach and treat some of the most serious neuromuscular cases that appear in children with developmental disabilities. By 2004, with her fluency in Spanish and expertise, she was one of the lead PTs in Washington Heights and Harlem. In 2010, she created the course A Fresh Approach in the Treatment of Torticollis. She teaches throughout the United States and has taught in Italy and Turkey. Students who come to her workshops are amazed to see the ease with which she moves them and gets them to learn better postures, especially how to gain the trust and connection with the babies to address their cervical tightness and habits. She has worked with well over 1,000 babies and has a private practice in Demarest, New Jersey, and works in a public health clinic 2 days a week in Monroe, New York. For more information, please visit her website at nancypt4kids.com. Welcome, Nancy.
Hi, thank you.
Hi. So that's quite a bio that you have there. You've been doing this work for a really long time, and I know it's something that you're really passionate about sharing with our audience today.
Oh, yes. No, I absolutely. I always tell my families it's more than a career. It's a hobby. Because I work a lot on the weekends, and it's just fun to see children develop and change and gain the confidence and the skills to be able to ultimately really learn how to walk, because that's the goal, is to really get them up and moving. And I say walk because for so many children with neuromuscular challenges, that is such a difficult thing for them to do. So that's my ultimate goal.
Yeah, so I know a lot of your clients are a little bit more severely disabled with their milestones and their motor skills. Yes, and some just come with minor things, like they were premature, and so they're slow to develop, but they're absolutely going to do everything. The important thing is to not push them beyond what they're capable of. You want to go step by step, exactly according to what it is that is easiest for them in that moment, to make it easy and fun and not too challenging. Because that challenge is not actually, while parents think it's good, or older people think that it's good, no pain, no gain. That's not the way it is in learning with children. It's got to be very effortless, and then they'll do the next thing. But it takes a lot of patience, because they're not always doing what it is that we want them to do, and that's where the professional steps in and says, we're not going to go according to what the parent wants, but what's according to what the child is able to do and what they're ready for, and that's the big distinction. Right, and I know that we've been sharing patients for years now that have gone back and forth, and so I would love for you to just tell the audience today, what is your personal story of why you're so passionate about working with children as a physical therapist?
Well, I think one of the major things is that when I was 9 years old, I wasn't reading so well, and my parents thought that I had a reading problem, so they found out about the Institute for the Achievement of Human Potential in Chestnut Hill, Pennsylvania, and they sent me down there to be evaluated. And it was based on the Doma Delicato method, and this was in 1967. And that was the method that if a child learns how to crawl, then they'll learn how to read better, and they'll have better speech, and they'll move better. And if they don't do that, they can have all kinds of problems. So they sent me down to this institute, and we walked into the basement entrance, and it was many, many children with horrific disabilities in wheelchairs and very, very, very cognitively very compromised. And so that was my introduction, and then they tested me and they decided that I needed to learn how to crawl. And the message to me was that there was something that was wrong with me. And for a year, I had to crawl for almost an hour a day and do these cross-pattern walking and do all kinds of crazy exercises. But it was very tedious, and it was really boring, and it made me feel bad about myself. And they were nice, but it was a bad message. And I don't think that it was accurate. And I speak many languages, and I read really well, and I think it was something, that was going on in my family rather than something that was wrong with me. But the message to me was I better get it together, and I did. But I wanted to have an impact on children so that they would never feel that way. And that was kind of how I started. And then being a dancer, a modern dancer and a yoga enthusiast in my teens and in my 20s and going to college to dance, many people who ended up not becoming modern dancers as a career ended up either being chiropractors, physical therapists, or massage therapists. And I thought that the thing that would be the most interesting to me was to be a physical therapist and work with children, because I always loved children. And so that's how I ended up getting started. That was the beginning.
That's quite a story. So I'm excited to get to that. But first, let's start off with, if you could just explain to the parents listening, just, in a healthy baby, what are the gross motor milestones that a parent should be looking for?
So when babies first come home, they're rolled up into a ball, into physiological flexion, and that's normal. You don't want them just kind of with their arms outstretched all the time and everything loose. And a doctor would tell them if there was something that was unusual like that, because they're normally in that ball. And they're going to be in physiological flexion for several months with, starting to turn. They mostly turn their head to one side or to another side. They don't keep their head so midline. They don't have volitional movement at this point. It's more reflexive that, you touch the foot, the one foot comes out, you put your finger in their hand, they grab your hand, that the hand, they have different grasp reflex, or if you stroke their cheek, they're going to turn their head to the side that you're stroking, the rooting reflex. So they're really dominated by reflexes. And then as they start to expand, and then they can, if you put them on their stomachs, let's say at 2 to 3 months, because if you put them on 1 month, it's just too much. They'll start to, between 3 and 4 months, they'll start to roll pretty much from being on their bellies. They'll be lifting their heads by 3 months when they're on their bellies, and starting to roll 3 to 4 to 5 months back onto their back. And then you'll want to see them be able to roll around 4 or 5 months. Not all babies will, but that would be the first thing that you would want, is rolling after lifting their head up in prone propping. Or they could just go from being on their backs to starting to roll onto the side at 3 to 4 months. And you want to help them to do it to both sides. And then once they're 3, 4, 5 months on their bellies and looking up, then you would want to see, after they're rolling, them starting to maybe combat crawl, which is belly crawl. So they're on their stomachs, and they, with their elbows flexed and their hands fisted, they can start to propel themselves forward a little bit on their bellies and frog-leg it. So they look like they're in combat, going underneath something at about 6 to 7 months. And then 6 to 7 months, you're going to see them hopefully get up onto all fours and rock, and then come back down, and rock and come back down. And all this while, they're not coming to sit yet. So I do not put children into an independent sitting position with pillows around them, and I'll explain why. So between 6 and 7 months, to get into quadruped, which is on all fours, rocking back and forth, and then 7 to 8 months, they'll start perhaps crawling, and usually they go backwards first, because it's easier to go back and push than it is to propel yourself forward. Around 6 to 7 months also, you're going to see them go from being on all fours to coming back on one side to sit through the side. So they look like a half frog, coming back to sit and then going back onto quadruped. And that would be the way that children learn to come to sit. And what's important about that is that it gets them to twist in the spine and to turn the neck and to use the pelvis in a way that they're really organizing themselves for later on to move better, as opposed to picking them up and plopping them into the sitting position with pillows around them. What happens is that when you just put a child into sit at 6 or 7 or 8 months or 9 months, if they don't do it themselves, they just get there and they're there. And then what will happen is a lot of times they don't know how to get back from that position, or they don't know how to get into it again. So one of the most important things are the transitions. It's not just that the child can roll or that they can crawl or that they can sit, but it's how do they get in and out of those positions, because they're going to need to do them over and over and over again. And if you simply, and one of the problem that parents have is they say, oh, but they're so bored in lying on their backs. Well, you can put them in a high chair, right, and they're sitting, but at least they're strapped in, or you can put them on your lap, but they're not just sitting there with pillows around them independently. So after they come up to sit, let's say 7, 8, 9 months from being on all fours and crawling, now they're coming to sit, going back down, coming to sit, going back down. Then they're crawling, let's say now forwards, so 9, 10 months, they're crawling forwards. They go up to a piece of furniture or up to a chair leg, up to a parent's leg who's sitting, and now they're going to reach one hand up, and then they're going to push up and maybe come to stand. So it would be crawling, sitting, then coming over to furniture, coming up to sit, then kneeling, then coming up to stand, then coming back down. So usually they plop down first on their bottom, and then they figure out a way to bring one knee down and then the other knee down. And then at 11 months, and these are all very variable, but I'm giving you the sort of the gold standard, star standard of the most sort of rapid babies. Then they go from standing at the piece of furniture to walking sideways, 11 months, side to side, around the furniture. And then at 12 months, theoretically, they can start to try to take steps by themselves. And again, this can go, at 12 months, or this could be up until, let's say, 18 months that they start to walk. So you can stretch all of these milestones out. They could start crawling maybe at 11 months or at 12 months. So it really depends on the child. Some kids are not so fast with their milestones, but they're perfectly fine. They're just thinking about other things, or they're learning how to talk more, or they're better with their hands. So it really is within normal limits, if it goes up to 18 months. And you have to, unless there's a big problem where the pediatrician really sees that there's a lot of weakness, or that they're having a lot of trouble, or they're always on their toes, there's some kind of unusual thing that they're seeing, or one side is different from the other, it's okay for them to explore and to not do it by 12 months. I mean, I get calls from people saying, oh, my baby's not walking and she's 13 months. It's okay. It's usually okay.
Yeah.
So and then from walking, then they start, taking a faster walk, then they start crawling up the stairs on their hands and knees, which is actually a good thing because they learn to go forwards. Because what happens is if you hold a child and let them just bring their legs up the stairs and they're leaning backwards, that's not going up the stairs. Mm-hmm. Because walking and climbing is a forward motion, and you don't want to hold their arms over their heads and have them kind of half leaning back and moving, because that's not going forwards. Mm-hmm. And also they have to learn how to fall. So when babies come up and down before they're cruising, they're learning how to keep their weight forward, they're learning how to fall back on their bottoms, they're learning how to come forward, how to fall back, and how to protect themselves on either side. And that's something else I didn't talk about. In sitting, once the child does come to sit, between 6 and 9 months, 6 and 10 months, they get protective extension to the front, which means that if you push them forwards, they put their hands out and catch themselves. Then they get protective extension to the sides. And then at 10, 11 months, if you push them back, they reach their hand back. It doesn't happen until then. And if they don't have those protective extensions before they get up to stand and walk, that's a problem, because that means that if they lose their balance, they'll fall on their head. And that's not okay. So when I work with children, no matter what their issue is, I make sure that they can protect themselves first in sitting, then in kneeling, then in standing, before we work on walking. Very important.
Mm-hmm. Wow, that's such good information.
I hope.
And I think, yeah, and I think, the big message here is for a normally developing child, there is a lot of fluctuation between children. So, if your child's not walking by 12 months, this does not mean that there's necessarily a delay in your child. It just means maybe they'll start walking at 18 months, and that's still normal development.
I had a colleague who brought his baby to me who was she very big bottom. She was adorable. Big fat legs, big bottom, big round face. And she was 16 months, and she was just starting to crawl. And the neurologist at CHOP was like, we have to do an MRI, blah, blah, blah. I mean, they were just up in arms. And I took one look at her, and I worked on her, and I said, she's just a kind of a soft, lower tone within normal limits. Everybody, by the way, uses the word low tone. Like, everybody has low tone in the last 10 years, every baby. And I wouldn't call it low tone. There's different kinds of kids. There's very strong kids who are very muscular, and there are kids who are medium, and then there are kids who are on the softer side. And I feel like in her case, she was just a little bit on the softer side, and within like that day, she started crawling around. And the parents told the neurologist, well, she's crawling now. And she said, well, that's not good enough. I still want to it was just, and sometimes they just get crazy. And I think that that's really an overreaction. And now she's walking, she's doing everything. Within a few months, she caught up. And a lot of kids they're just a little bit slower gross motor-wise. And it has nothing to do with anything except that, if you were to ask the mother, well, when did you learn how to walk, or when did your husband learn how to walk, it was probably a little bit later.
Right. There could be a little genetic component there.
Very genetic, yes.
Okay.
And also the opportunities that the children have for moving, and whether there are other kids in the house, and whether they're always put in bumbo seat, mostly, in an exerciser, or they're, so if they're in all those contraptions, they're not going to move as well, probably, or a jumper or a walker.
That's such a good point. And then, like you said, if I'm assuming this is an only child, because I see it a lot in my office. The second, third children, they just want to keep up with their siblings.
Right.
So they're like really motivated to move.
Right. Oh, absolutely. And the other reason why I don't like to put kids in sitting is a lot of times then they'll just scoot on their bottom as opposed to get on their hands and knees. And once a child is scooting on their bottom and not on their hands and knees, you forget about ever getting them on their hands and knees. It'll never happen, no matter what you do, because they're so fast at scooting on their bottom, and it's not a good way of using themselves, because one of the things that happens when babies put their weight through their hands and crawl is that they develop the thenar eminence by the thumb, and they get strength in the hand, and they start to get more strength in the arms, and the hands get stronger, but the arms get stronger. And so later on, when they go to do things like play the piano, play Shostakovich on the piano, play Beethoven, the fingers can be used very lightly, and the strength comes from the upper arm and from the forearms that have now had the strength and had the coordination of learning how to go forwards and backwards and cross-pattern walk and, on the hands and knees, and use the head in a way that the head goes to one side, then to the other side. Then they have the strength in the arms, so they don't have to muscle their way through with their fingers, and then they can play much better, or they can do fine motor activities much more easily, or their handwriting is better because they're not, if a child doesn't have the strength in the upper arm, they're going to use the strength in their hand, and their hand's going to get tired, and they're going to grip too hard on the pencil. So the fine motor skills are going to happen by just it's not by giving the child things to grab and play with, it's by weight bearing through the arms and crawling, combat crawling first, catching themselves and crawling around the house and coming up to stand and grabbing. That's where they learn to use their hands. And they won't get that if they're in an exerciser. They're just spinning their hands around on those stupid contraptions. They're not weight-bearing through their hands. And that's what parents don't understand, that the greatest use of the hand comes from pushing and weight-bearing through the hand. In
that crawling position.
Yes. Or walking on the hands and feet is another one, and that's something that's really good. Bear walking is very good for getting use of the upper body and getting extension in the neck and strength in the back and coordination through the pelvis. It's all in all those movements, twisting, coming back up, going back down. And that children do it all day long. They do it a million ways, And it looks like they just learn it one day, but they're figuring it out every time they start rolling. That didn't work, this worked. When they find what works, they do it over and over again. They do all these different variations until they come up with the one that works. But it's all those variations that get put into the brain that creates all the synapses for them to do things in an organized way over and over. And that's what we do as ABM practitioners and Feldenkrais practitioners. We don't just put the child in the desired position. We're constantly giving them different ways of doing something and creating the conditions for them to do it themselves in a lot of different variations. So not just hammering something away for 45 minutes. So if you want to teach a child to roll, you don't just roll them constantly in the session. You have them reach up. You have them look back. You have them, look this way, then look this way. You do it this side. Then, there's all these variations.
Mm-hmm.
So and that's what children normally do as they're learning. That's what we all do when we learn something new. So that's kind of how it progresses.
Yeah, and what I'm hearing from you, too, is a lot of this is really up to the child to take their next step. So it's really just creating the environment and the space for the child to figure it out and get themselves into these different, positions instead of just putting them in a position and then putting them in a different position.
Right, or saying they need core strength. I mean, babies do not need core strength the way that we think that anybody needs core strength. I mean, by walking on their hands and feet, by doing positions that look like down dog, up dog, crawling, coming up, coming back down, twisting, they're strengthening their core, because that is strengthening. It's not this sagittal plane going straight up and down. I mean, I see therapists giving babies exercises to come straight up and back down in the middle of, bringing their head towards their feet. And first of all, no animal and no baby comes up to sit like that. No human being comes up to sit like that normally. We come up through the side. And secondly, it's not the way that we move, and it's very tightening for the neck and for the back, and it's not really getting at what you need for the kinds of strength that you need in order to move through space. That's a falsehood, and it's an unfortunate one. So I hear a lot about core strengthening for what they call low-tone babies who are really not low-tone at all. They're just on the lower side of what we expect. But if you give them the opportunity and you just help them out a little bit with their shifting of their weight, they start moving beautifully and very gracefully and very nicely.
So, for a parent, what is some of the best tips you can give them about how to properly carry their baby, and even create tummy time at home so that they're going to help their child develop at the normal milestones?
Probably to keep them out of the car seat unless they're in the car and they have to go somewhere.
Yes, I'm a huge fan for that, too.
Yeah, I mean, the car seat of all the contraptions is the worst because of the flexion in the spine and the way they're crushed in there.
Yeah.
In a newborn, I prefer for them to be really flat, like in an old-fashioned pram, on their back or on their stomach, preferably on their stomach in that position if they're just wheeling them around, because then they can start to lift up their head and be comfortable in tummy time. If they're very, very, very young, I would never just put a newborn baby or 1 or 2 month old on the floor and expect them to do tummy time. If you want to do tummy time, put the baby on your chest to begin with and have them, and you start to lower down slowly so you're not completely flat, or have the baby you're on the floor or on the couch so they can see something, so they're not just with their head down and uncomfortable. Do it only when they can tolerate it, and certainly I wouldn't put them to sleep on their stomach because there really is a risk of SIDS that's very real, and unless they can roll over by themselves. If they can roll over by themselves, it's not a problem. If they can lift their head easily, it's not a problem.
Mm-hmm. But we're talking probably 2, 3, 4 months old at that point?
At 4 months, yeah, but not at 2 months or 3 months, because they're definitely not going to be able to roll. And the risk of regurgitation when they're in prone, since the larynx is lower than the esophagus, if they vomit and then inhale, it'll go down the larynx and then they can't clear it when they're prone. And also there's so much more nasal mucosa that builds up when they're prone that they really can develop many more respiratory infections if they're that young and on their stomachs sleeping all night and they can't clear it or they can't turn. But so being on the stomach is good as long as they're tolerating it and they're comfortable. Doing it because the pediatrician says to do it and they're screaming their heads off is pretty bad. I would not do that. You can also put your hands underneath them and prop them up a little bit. I wouldn't use the regular, there's a, what is that called? I forget. There's one that they put them underneath their chest, and it's very thick. It should just roll up a diaper, not a diaper, roll up a towel and put it under their chest a little bit.
Kind of like a boppy pillow?
Yeah, that's it. But the small boppies are better. The big boppies are too big. The ones
for a small child, yeah.
Right. And then, carry them in your arms, side to side on either side or sideways, like a football. That's a nice way of holding them, carrying them around. Just...
What about like a baby wearing contraption?
So wearing them either facing out or facing in. I haven't... too many people I know don't come in with those, so I don't know. What's your experience with the...
I love the carriers, but you never want the baby facing out because I've seen it, and I've read research about how it stresses the hip joints in that position.
They're too far out? Okay.
Yeah, and it's also bad on the parent's back because of the weight of gravity. It's like everybody's getting pulled forward.
And
so
what about the sling?
Yeah, the slings, the baby's always facing in, and so, when they're really little, like you mentioned, they're in that, flex position,
right.
So they can just cuddle right up there in the sling, and then you can even easily nurse them.
Right, that's a good one. So then they can also, I guess, be on the sides. They have some that are for the side.
Yeah.
Then that's good, yeah.
Yeah.
I mean, it depends if they're urban. I mean, if people are walking around a lot, then they might want them facing, on their hip or facing inwards.
Right.
You're right. You don't want to overstress the hip. But I will say that I think a big myth is that when kids W sit, that's a big problem. And actually, one of the leading pediatric podiatrists, Dr. Paul Jordan, and I were talking about this recently. And children's hips internally rotate very easily. So when they sit and you go into the playground and you see 50-60% of the kids W sitting, it's not a problem. And everybody freaks out about it, and I don't think it's a problem at all. And I think that it comes from the fact that children with cerebral palsy, that's the only way that they can sit. And so people have sort of equated that with a big problem, and I just don't think it is. I don't think it's a stress on their knees or their hips because they wouldn't do it if it were. It would be uncomfortable. And as a matter of fact, as you get older, your internal rotation in your hips is limited because, as you become arthritic in the hips, you can't internally rotate. That's part of the capsular pattern. So I think if you have great internal rotation, you can use it, and it's not a big deal. And it doesn't always mean that the child is a low tone or has a problem.
Mm-hmm.
It's like Down syndrome children. In order to come to sit, they do a full split with their legs out to the sides like Nadia Comaneci, and they do that because they can, and it's not a problem. It doesn't hurt them. That's how they can do it. And everybody freaks out and says, oh, they need these special pants, and no, they can do that. So, you want to teach them something else, but it's not the worst thing in the world. So there's all sorts of myths about,
That's such a good point you just made. Like children are going to work with what they have, and they're going to figure it out with what their body is comfortable doing, right? What feels right to them, without getting too in their mind about what they're supposed to be doing, like adults do.
And all these therapists crisscross applesauce. Don't let your kid W sit. I mean, I cannot tell you. Every physical therapist I know says that, and I can't disagree more. I would love to see them side sit to either side also. I want them to have every option available, not just sitting with their legs crossed, because it's so limiting. I mean, why should they just sit like that when they can do a million different things?
Yeah, it's all about, like you said, having that flexibility and maintaining it. My little niece has Down syndrome, and she's turning 3 at the end of this month, and I, got to watch her with her milestones, and I know exactly what you're talking about. Like, she's so, because of the hypotonia, she's got, like, flexibility that you're like, woo, just legs all over the place. But she's been able to, develop normally in her body with what felt right for her, and she's, running now, which is really cool.
Oh, that's great. And also, because they have different collagen, their ligaments are just so loose. It's incredible.
That's
so
right.
They can just do it. It's nothing. It's absolutely nothing. Very funny.
It is funny. It's so cute. So I think this is for parents to recognize that, it's good to just really create space for your child to really grow and move their body and what feels right for them at that point, and not be so caught up on necessarily, they're this number months old and they're supposed to be doing this, but just giving them space to move.
Exactly. Yeah. Absolutely.
So you had shared a little bit about, different ways that children roll and sit and walk. Was there any other points that you wanted to make on that?
I'm sure I can think of many, but I think that, if you see a child always going up the stairs, always using one leg, those are the things that you want to address, maybe more professionally, because you want to make sure that they're doing things to both sides. And usually those children that do that probably crawled with one foot in front and on one knee. And so one side became very strong, side they kind of pulled along. And that's usually the biggest problem, and they just need to balance that out a little bit. But those are the things that need to be addressed, so that they're not lopsided.
That's a good point. So if parents are seeing like asymmetry in their child's movements, then that's a good time to bring them to a professional, like a physical therapist, a chiropractor, someone who's going to help them create symmetry in their body.
Absolutely. Yes.
And I know that you're super passionate about the topic of torticollis, and you go all over the world teaching physical therapists about torticollis treatment. Can you share with our audience a little bit about what is torticollis and what your recommendations are regarding it?
So torticollis is the most common form of torticollis is congenital muscular torticollis, and that's just that one side of the neck is either tight or one side is loose. And it comes usually from it being in utero, not having enough room, having multiple births, having low amniotic fluid, being in one position for too long, or it comes from being on the back for sleeping and always turned to one side, or mostly being in the carrier, the car carrier. And always having the head tilted or always being in a swing because a child may have reflux or some kind of condition like that. And so if it's congenital muscular torticollis, and you'll see that one ear goes to one side, and they look the opposite way. Right. So they're tilted to one side and looking the opposite way. And the side that they're turned to, the back of the head, is usually going to be flat because they're always lying on that side. And so it looks like a big problem, but it's actually if that's what it is, it's a small problem, and it should be dealt with right away. And the way that you deal with it right away is get them out of the car seat, get something called a snug and go, SNUGGINGO, which is just something for the car seat or the stroller or the swing that keeps your head midline. It's really good. And by getting them to look to the opposite side, and by holding them in a way that they're not letting their head always tilt to that one side. And if a baby's just a few months old and you start doing that right away, it goes away right away. And you need very little intervention. And it's certainly not something that needs a year of attention paid to. Right. And I see kids being treated for months, many times a week. And what I find is that the therapists can tend to be very heavy-handed. And by being so heavy-handed, or the parents then learning stretches in a heavy-handed way, the babies are just so unhappy that they end up closing off that side that the people are trying to stretch because they're so upset that now they're doing the opposite. And so it doesn't go away. And so they end up just perpetuating this habit of keeping like the right ear towards the right shoulder, looking to the left. And the problem doesn't get better, and then they have to get treatment forever. And if the parents will just, put the babies on their bellies in a way that doesn't feed into that side, because if a baby has torticollis, and let's say their head is tilted to the right and they look to the left, when they put the baby on their belly, the baby's just going to continue keeping the head turned to the left, and you're almost going to make it worse by putting them on their stomach, because now they're doing it in a way that now they're reinforcing it. So unless they learn how to do it the right way, which is to balance it out so the baby can keep their head midline or look to the right, then you're not helping them. So then it needs to be addressed in a way that, and just by doing home program of constantly changing positions, usually it'll get better with very little stretching. Mm-hmm. And if you do any stretching, it's very gentle, and the baby doesn't even know you're doing it. So it's a very different approach.
Yeah.
And it works. It works.
Yeah, I know, we've talked about this years ago, it's not normal for babies to be screaming when they're being stretched. So this is their way of saying, stop, that hurts, right. Don't do that. And so we have to really respect, what feels good for their body and what doesn't. And this is not, these are babies, they're a few months old, they do not need any intense stretching.
No, and with adults, we'll say to somebody, the therapist or the athletic trainer will say to the patient, tell me when I've gone too far or if I'm going too far. But they don't ask the baby that, and they just do it, and the babies are screaming, and the therapists are saying, oh, we have to do this, I'm sorry. I mean, that's ridiculous. And when the parents do it, the parents don't know what they're doing, and necks are pretty delicate. I mean, it can be really damaging, I think. So I don't think it helps. Right.
So, I mean, typically I know you've treated so many babies that have had this condition with torticollis. How many visits do you typically have to see them for?
I mean, if they're under 3 months, I see them 2 or 3 times.
Yeah.
And if they're 6 or 7 months and it's really bad, I mean, recently the worst case I've ever had took 5 months, 3 times a week.
Wow.
And that was really bad, and now he's fine. And then I recently had a child who had a horrific torticollis with some other things going on, but what I realized is that he wasn't using his right hand, so he was always oriented to the left. So as soon as I got him using his right hand, then he started to turn his head towards the right. So you really have to look at other things. It's not just the neck. It could be the hip. It could be the leg. It could be the hand. It could be it can be an eye problem. I mean, it has to be really looked at by a professional. But if somebody goes to a therapist and the baby's screaming their head off, it's not a good sign.
Right. And, I think that's a good point, too, is this is really about being holistic. So, not just looking at where the area of restriction is, but looking at if there could be other potential areas of restriction, because that's going to potentially impact the neck.
Right. And I had a child with Down syndrome at a demonstration once, and they kept saying he had a left torticollis, but what it was is that he was always side-sitting to one side, and he never knew how to side-sit the other way. So he was always stuck in a position of always tilting his head to one side, and he had nothing wrong with his neck. And as soon as he learned how to side-sit the other way, his head came right in the middle. And that was the issue, but they had to learn that you have to look at the way that the child moved.
That sounds like that was a riding reflex. His eyes were wanting to stay on the horizon, and that's what his body was compensating with. That's so interesting.
It was really interesting. That was a very interesting case. And I see that all the time, that the problem is not so much in the neck, but that they just, everything has been on this side, or the mother always holds them on the right, or, because she has an issue with not holding that way, or when she nurses them, she doesn't, it's always mostly on one side, and the child, turns his head a certain way. So, when you have to look at it at the whole picture, a very
whole person, for sure.
Yes.
I just wanted to close this interview with, and you've kind of hinted so far in this interview about your opinion on different apparatus for children like jumpers and walkers, but can you kind of go a little bit deeper into explaining how you feel about these appliances for children?
I think that if a child knows how to crawl, you can put them in a jumper after that. If they know how to crawl, you can put them in an exerciser. It's like once they really get that crawling going, then you can put them in whatever you want. But it's up until then, and that's the rub, because people get frustrated and they say, oh, but he's so bored. Da, da, da. Well, you have to spend a lot of time with kids, and you have to be on the floor with them. And the problem with being in an exerciser is it's like being in the being held in those in those carriers where they're facing out. It's not great for the hips because their legs are spread out.
Right.
They're arching their backs, and they're not really bearing weight through their legs. And that's not the way that children learn to bear weight anyway, because their weight is so far back. You bear weight on your hands and your feet first, like a monkey. That's how you learn to move. Hands and knees, hands and feet. And none of those apparatuses deal with the hands. It's all about jumping or being on the legs without any connection to the upper body and to the neck and to the trunk. And that's the problem. So,
even a child who isn't like weight bearing yet, you're okay with putting them in like a jumper?
If they're crawling around the house and they're coming up to stand, then you can do that sometimes a little bit. And I actually use jumpers for kids who really have a hard time pushing through the floor, like some very involved kids. I'll say to the parents, let's get a jumper to start to get them to feel pushing with their feet. So it can actually be a good tool sometimes, but mostly, to do this to a young baby that, just is hyperactive and all over the place and doesn't know how to move well, just put them in a jumper or in an exerciser and a walker, not good. And a walker's kind of never good. Maybe a walker's good if you need to take a shower and you don't want the child to burn down the house and there's nobody else around, then it's fine. But
right.
That's it. It's not a tool that's helpful for learning how to move, put it that way.
Yeah, and I think a lot of parents may, like you said, kind of use it as like a babysitting tool, and like it should just be really done minimally.
Right.
So that, like you said, if you need to like take a shower, But at the end of the day, at that age, children need interaction and like with a human.
Right.
So not just
a lot of interaction. Heavy interaction. Yeah.
Exactly. Not just sitting in front of a TV.
No, and there's a pediatrician I know who won't let kids watch TV like for the first 2 years. It's incredible.
I think that's awesome.
Yeah, he's really Barry Stein. He's amazing. Carnegie Hill Pediatrics in the city. He's amazing. But it takes a lot of resources to have the time to do that, and not everybody can do that because they work and they are child care, yada yada yada. But yeah, and also I would just say one more thing is don't be on the iPhone all the time because that's really distracting and not good, and kids are they know that you're not paying attention to them. That's my own plug.
That's such a good point. So not only let's unplug the kids, but let's unplug the parents when they're the primary caretaker for their child. And I see that a lot, actually. I see, moms in Hoboken, walking the stroller, the baby sitting in the stroller, and they're totally on their phone, texting or completely distracted. They're not paying attention to the child. And there's times that you need to check your email, but you don't have to check it every second. And, this is about connecting with your baby. And even even newborns are wanting to feel that connection and that love. So, this starts at birth, that you want it when you're with your child to be fully present is so important because it's going to teach them also how to be present. That's going to impact them the rest of their life.
Right. No, I totally agree.
Yeah, such a good point. Well, Nancy, thank you so much for coming on the show today and sharing your wisdom regarding children's development. I'm so grateful.
Thank you for having me. I really appreciate it. It was fun.
Awesome.